soya beans, soya milk are part of their staple diet. And the incidence of heart disease and breast cancer is very low. So we know that also from the philosophical viewpoint, if you take something extracted from a food that you consume anyways, why would that be harmful? It's going in your stomach anyways if you consume the food. Now we are extracting a specific ingredient from that food and consuming it. So they are much, much safer. But to make them bioidentical, you have to undergo one more step. They are not exactly a female body's hormones chemical structure. There is a small variation. Now in the chemistry lab it has to be modified. There's a group that you remove that and put the group that is in a woman's, that comes from a woman's organ. Remember, everything in your body, every molecule, every protein, every carbohydrate, it's, with the exception of protein, is made out of a carbon backbone. Does anyone know our body is made of 4 elements? You name those 4 elements, anybody? 4 elements make up 99.9% of your body. Water is not an element. Water is a molecule. Water is, you have to combine hydrogen and oxygen. You combine elements to make a molecule. Now it's called a molecule. Then there's more than 1 atom. So water is a molecule. But guess what? In saying water, you already got 2 of the elements out of the 4. Because 70% of the body is water. So what is water made of? Hydrogen and oxygen. So right there, since 70-80% of the body is made of water, 2 elements are right there. What are the other 2? Calcium is a micronutrient. They are in very small fractions. Hydrogen, oxygen, nitrogen, and carbon. These 4 things make 99.9% of your body. If you're wondering what about calcium and magnesium and all these supplements that Dr. gives me, they are probably 1/10 of 1% of your body. They help in chemical pathways, they work as enzymes. The vitamins are also micronutrients. They are in very, very small amounts, but they are very extremely important. So getting back to the discussion, I very easily go off the tangent, so please bear with me. I have that habit of going into other discussions. So we were talking about in order to make a hormone bioidentical, you have to remove that group which is attached to the carbon atom and replace it with the one that a woman's ovary makes. That's bioidentical hormones. And that is one of the reasons almost all practices in the United States that practice bioidentical hormones, they don't use insurance. It's very hard to get it from them, get reimbursement. I continue to do that as long as I can get away with it. Don't bet on it. One day they might come and say, this is cosmetic medicine. This is like a nose job or a boob job. They may shut me down or say, we will not pay you anymore. But we will do for as long as we can get away with it. So that is the definition of bioidentical hormones. What are the risk benefits of hormone replacement therapy? As I said, the WHI study showed that there were some harms, but you can use that in small doses. Ever since that study came out, I completely stopped using synthetic hormones. Not that I believe that you can't use them in very, very small doses for a short period of time. I may have just a very few patients on them just for their symptoms because they absolutely cannot afford anything else. They don't have insurance, so I give them just to treat their symptoms, knowing that that will be safe if it's used for a limited amount of time. Bioidentical hormones, on the other hand, which has been used for 10, 11 years now, actually they have been used for 30 years almost. We started using in the 1970s, but because of the politics of medicine, the doctors, the FDA, the insurance companies, everybody was giving synthetic hormones. All of a sudden, the whole world woke up to bioidentical hormones in 2000, and women heard on TV, they panic, they don't want to want those hormones anymore. That's why bioidentical hormones now have the opportunity to raise their head and become more popular 10 years ago. Even I used to use synthetic hormones in the 90s because I didn't know any better. Then I started doing research and learned a lot about it. And ever since that time, I strictly use bioidentical hormones. Now, all the studies done on bioidentical hormones does not compare with the amount of study that was done on synthetic hormones, because synthetic hormones have been used for more than half a century. Bioidentical hormone, the research started in a big way only about 10 years ago, so the amount of research available is limited, but the research that is available so far has shown that bioidentical hormones have all the benefits that were traditionally believed to have from hormones, but there is no harm, the new harms that were described by synthetic hormones. So what are those benefits? Benefits are, number one, that everybody is aware of, they prevent osteoporosis. Osteoporosis is a process which begins at as early as the age of 20, believe it or not. Women after the age of 25 start to lose about 1% of their bone density. As they hit menopause, pre-menopause, they start losing about 2% of their bone every year. And once their ovaries completely shut down and they're in menopause, they can lose as much as 3%. And who is the prime candidate for that? Women of Northern European origin. They come from cold climate, and also considering the fact that in the last 100 years, because of the change with the industrialization of the Western world, most of us spend more time indoors. Our exposure to sun is not as good as it used to be for the last 2-3 generations. And as a result, not only osteoporosis is an epidemic, but also we just found in the last 2 years, and there is a later on seminar just on this, on nutrients, the value of nutrients. And vitamin D is one of the nutrients. Right now it's an epidemic. It's not an epidemic only in the United States, but all over the world. Why? Because about 50 years ago, the United States government set up a standard. They said the daily recommended dose for vitamin D is 400 international units. So every bottle, every health food product, every carton of milk and cheese and orange juice says daily recommended dose 400 international units. As a result, they first time figured out in the last 2 years that such high incidence of breast cancer, colon cancer, rectal cancer, and osteoporosis in women could have been avoided if the government knew better. Now the government knows. FDA is having serious meetings about that. A year or less from now, I predict that government will change the daily recommended dose from 400 international units to 1,000 for everyone. This is such an epidemic, I could almost bet with you, someone who has not tested, go ahead, test yourself, test your entire family. 9 out of 10 people in your family will have a low, very low vitamin D. We have tested about 300 people. There's only one patient out of the 300 that I found had a vitamin D level that I did not have to supplement. The number was 65. Actually, I saw her yesterday. Majority of you will be below the standard. Okay, this discussion is not about vitamin D. I just wanted to mention that this is directly related to osteoporosis. Hormones prevent osteoporosis. They do 2 things. Just like some drugs that are used for osteoporosis, they also do 2 things. Number 1, they prevent the yearly loss. They stop the loss. And then the second thing they do is they do to some extent rebuild your bones, give you a little bit of new density. I have a bad news for you. What drugs and hormones are good at is to prevention of the loss. They are not that good at giving you the new bone. This may be discouraging for you, but let me ask you a question. If you see a person who had an accident on the highway and is bleeding, there's a blood vessel, ambulance comes, the blood vessel is oozing out. A lot of blood. The ambulance people, what do they do first? What do you think they should do? First, put a stitch on that blood vessel or hook up the bottle for the new blood?
Stop the bleeding.
Thank you. That's common sense. So, by preventing the loss of your bones every year, out of the two things, that's what really is important. If you could reserve your bone that you have, the density that you have today at the age of 45 or 50, and do not allow it to get worse, you dramatically reduce your chances of your hip fracture. Then it happens typically in 70s when it becomes brittle enough. That is one of the things hormones do for you. Now, hormones alone will not do that, because the actual cement, the actual brick and mortar, or the dirt that builds up the bone inside, that's calcium. Calcium is the actual cement, which means you have to be supplemented with vitamin, with the calcium. Now, human biochemistry is very complicated. It doesn't end there. In order for the calcium to go into your bones, you need a vehicle that will physically pick it up and bring it into your bones, and that vehicle is vitamin D. And that's a big problem right now. You have to have, in order to rebuild your bones or to prevent the loss, you need hormones, you need calcium, you need vitamin D, you need magnesium. Instead of taking calcium alone, it's best to take calcium and magnesium supplement together. The second most important benefit of hormone replacement therapy, which is non-controversial to this day, which was non-controversial even for synthetic hormones to this date. There is plenty of research that shows that hormone replacement therapy will reduce the risk of early onset of Alzheimer's disease, and it reduces the risk of dementia in older age. Now, this is not controversial. This is not an opinion. This is not what I think. There is plenty of research. This was true for synthetic hormones, still is, and is true for bioidentical hormones. Now, there are two other things that it turned out that we always believed synthetic hormones prevent heart disease. WHO study said no, it can do the opposite. If you use above certain doses, it can cause a heart attack. It can cause stroke. Now, these were the two scary things. Bioidentical hormone study for these two things show that they benefit you actually. That's what was believed about synthetic hormones, that they prevent heart attacks, they prevent stroke. That opinion was changed in 2000 for synthetic hormones, but that continues to be true today for bioidentical hormones. And there is quite a few studies. As time goes by, we will have more and more studies that will either confirm or refute it. So far, they confirm that there is a benefit to the early onset of heart disease starting to accumulate. They also help you with the prevention of heart disease indirectly. How do they do that? They knock down your cholesterol. Cholesterol is one of the risk factors for heart disease. So they bring down your bad cholesterol, which is called LDL, and they bring up your good cholesterol, which is called HDL, and overall they drop your total cholesterol. That's what hormones do. Now again, believe it or not, that is still true for synthetic hormones do that too. It's just that we can't give them because they can cause a stroke or heart attack. So these are the five primary benefits of hormones. If any one of you is on those drugs given to you by your primary care doctor, like Boniva, this and that, if you are wondering why not take Boniva, why take hormones? Two reasons. Number one, hormones are not just for osteoporosis. Boniva is just for osteoporosis. Hormones do many, many other things for you. And of course, you get a bonus. All your hot flushes and night sweats and depression and anxiety tend to improve. It's a global change. Just like it was a global deterioration, now this is a global improvement in your body.